Here is a clavicle. The clavicle is the collarbone, and it actually sits in the body kind of like so. It actually articulates at this round portion here. This articulates with the manubrium of the sternum. So this is the medial point, and this is lateral. Okay. Now this lateral point is actually going to articulate with the acromion process of the scapula. There's no structures that you need to know for this one, but you have to be able to identify it as the clavicle. Next, we'll talk about the scapula. So scapulae is plural, scapula is singular. This is a posterior view of the scapula. So this is looking at from the back of somebody, looking at somebody's back. The first structure that I want you to recognize is this large protruding structure here. And it goes from here and stops around here. Okay. This is the spine of the scapula, sometimes called the scapular spine. That's fine too, but spine of the scapula. Now, as I follow the scapular spine or the spine of the scapula out laterally, this would be lateral, this is medial, I'm going to have an area that flattens out and forms this protrusion here. This is the Acromion process of the scapula. Acromion process of the scapula. Now, the acromion process of the scapula articulates with, it's going to articulate with the lateral end of the clavicle. When I flip this over, this is now an anterior view or a front view of the scapula. You'll notice that the front view of the scapula is smooth. It's smooth because this butts up against the rib cage. Okay. And I have a structure here, and the structure's name actually means raven's beak. Now, if I look at it just right, maybe it looks like a raven. Maybe these are the wings here, you know, and then here's the beak. Here's the head. Okay. So this is called the coracoid process. Coracoid process of the scapula. Coracoid process. So it means raven's beak, but another way I like to think about this is I picture a witch with a raven on her shoulder, and she's got a long finger, and she's going, look at you, my pretty. Okay. All right. So crooked finger, coracoid. Crooked, coracoid, whatever helps you. Great. Whatever doesn't help you, forget instantly. And the last structure that you need to know for the scapula is right here. This is the glenoid fossa or glenoid cavity. Okay, glenoid cavity. Sometimes called glenoid fossa because it's just so shallow. This is part of your shoulder joint. So this is where your shoulder is going to be formed, your shoulder joint. Coracoid process, glenoid cavity, spine of the scapula, and acromion process. So this is the head of the humerus. Let me just show you all of it. Okay, so here, this rounded portion here, right? This is the head of the humerus. Now, the head of the humerus articulates with the glenoid cavity to make the shoulder joint. Now, one thing I want you to notice here is how flimsy of a joint this is. Okay, this does not have a very deep socket. This is why we have a wonderful range of motion with our shoulders, but it's a hot spot for injuries as well. Hot spot for what we call rotator cuff injuries, because those are the names of the muscles that help to control this area. This is the anterior or front view of this bone. The head, when I have this sitting anteriorly, most of it's kind of hidden. So here's that head. So here's the head of the humerus. This is an anterior aspect, front view. I've got a pronounced yet relatively small bump here. This whole thing right here. This is the lesser tubercle of the humerus. The lesser tubercle of the humerus. It's only visible anteriorly. The greater tubercle is much larger, but it's less pronounced. It doesn't, see how that juts out kind of nicely there with the lesser tubercle? There it is from the side. The greater tubercle is large. It's much larger. It's all of this, but it's not quite as pointy and pronounced. Doesn't stick out as far. So this is the greater tubercle. The greater tubercle. It's larger, but it doesn't stick out as far. Now, this is a posterior view. This whole thing is greater tubercle. Okay. So this whole thing is greater tubercle. And as I kind of rotate around, that's all greater tubercle. Rotating it more, that's all greater tubercle. This is the lesser tubercle. Okay. So on a posterior view, I can see a better view of the head of the humerus. And I see a good view of the greater tubercle of the humerus, but I cannot see the lesser tubercle from the back. All right, I'm going to flip this back over to the anterior aspect, and let's look at the distal area. So this is a front view of this bone. The structures that you need to know include the trochlea. So the trochlea looks kind of like a bow tie here. Okay, or maybe a spool of thread from here to here. Okay, so both of these bumps here is the trochlea of the humerus, the trochlea. Next to it, I have a very rounded protrusion here, and this is the capitulum of the humerus. The capitulum of the humerus. Now, the capitulum comes from the word tiny head or little head. Think of a baseball cap, okay, capitulum, capitulum. And I also have an indentation here on the anterior aspect. This indentation is the coronoid fossa. Remember, fossa means shallow bowl. Coronoid, so don't get confused with coracoid. Coracoid is in the scapula. That's crooked finger, raven's beak. Okay, for the coracoid. This is the coronoid. And a good way to remember that is just remember how annoying it is when you bump your elbow. So coronoid fossa. Coronoid fossa. If I flip this over to a posterior aspect, the capitulum goes away. I cannot see the capitulum from the back part. So I can see the trochlea, right? I can see the trochlea from the back view. And I have a deeper groove in the back here. So this deeper groove is the olecranon fossa. So this is the olecranon fossa. The olecranon fossa. Now for the fun part. Let's see what these things do and how they articulate. This is the ulna. Remember, the ulna sits under. Okay, so it's going to be on the pinky side of the forearm. Okay. And the first thing that I want you to notice is this U-shape. A lot of people say C-shape, but I'm like, why don't you just say U-shape? Because it gives it the first letter of the name of the bone. I'm like, oh, that's kind of cute. So this is a U shape, and this is the ulna. So it gives you the first letter of its name, which is kind of nice of it. Okay. So this entire portion here, this is called the trochlear notch of the ulna. The trochlear notch of the ulna. And the trochlear notch of the ulna is going to articulate with the trochlea of the humerus. Okay. And this allows for this movement. That allows reflection and extension of the elbow. So it rocks back and forth on the trochlea. So trochlear notch of the ulna, articulates with the trochlea of the humerus. When I bend my elbow, when I flex it, I'm going to bend it as far as I can go. There comes a point where I can't go any further. And the reason is I've got a structure on the ulna that's butting up against that. Okay, so on the ulna, we have three structures you need to know. The trochlear notch, the bottom one here is the coronoid process. So the coronoid process of the ulna. And the top portion is the olecranon process of the ulna. So what those do, when I flex, there comes a certain point where I can't flex it anymore. And the reason is I've got the coronoid process of the ulna is butting up at that point against the coronoid fossa of the humerus. Okay. Now, what about the other side? So let's flip this over posteriorly. Now, what you think of as your elbow, when you're leaning on your elbows, what you think of as your elbow is the olecranon process of the ulna. Okay. So this is what you feel as your elbow. This is the olecranon process of the ulna. And what this does is as I extend or straighten my arm, there comes a certain point that I can't straighten it anymore without hyperextending my arm and hurting it. So the olecranon process of the ulna at that point butts up against the olecranon fossa on the humerus. Now that's only half of the story of the elbow. The elbow is a compound joint. Okay, so it has two joints here. The joint that we just talked about is a joint that allows for flexion and extension. But what about supination and pronation, which is this movement, hand up, hand down? That movement comes from a pivot joint. This is the radius. Now remember, the radius is on the rad side, thumbs up, so it's on the thumb side. So radius. This is the head of the radius. The head of the radius articulates with the capitulum on the humerus. What that allows to happen is I can go like this. So pronation and supination is made possible by this compound joint. So this is the radius. The radius has two structures that you need to know. You need to know the head of the radius. So if I look at the head, it's just kind of this shallow little thing here. And remember, this is what articulates with the capitulum of the humerus. Okay, so this is the head of the radius. And then I also have a little bump here. This bump, that is called the radial tuberosity. Radial tuberosity. And the radial tuberosity is going to point towards the ulna. Okay, so it sits medially in the forearm. All right, so those are the only two things you need to know for the radius. Radial tuberosity and the head of the radius. This larger portion, that actually articulates with the carpals, which are the wrist bones. This is the sacrum. Another way I like to think of sacrum is a sacred heart, because it kind of looks like a heart shape. Okay, sacred heart, sacrum. Okay. This one has the tailbone attached. Some of yours do not. Some of yours has this broken off just because it's kind of flimsy, you know. So, but this is the coccyx, and the sacrum. So here is a hand. For the hand, all of these short bones here are carpals. Okay, these 8 bones here are the carpals. They all have different names for this class. You don't need to know them. Yay. So, but these are the carpals. Think carpal tunnel syndrome. Okay, the carpals are the bones of the wrist. Now, the bones of the hand are here. So this is the bones of the hand or the palm. Okay, so these long bones here. These are very friendly They like to meet up with the carpals, so they're metacarpals. So metacarpals. Okay, so carpals, metacarpals. The rest of these bones can all be thought of generically as phalanges. Phalanges. Okay. So your fingers have 3 phalanges, even your little pinky, and the thumb will only have 2 phalanges, one here and one here. The whole thing together is the pelvic girdle. There's only one structure that I can ask you about, and if I ask you about it, it has to be in the articulated pelvic girdle, and that's the pubic symphysis, which is this cartilage right here. So the pubic symphysis is where the pelvic bones or os coxa or hip bones, whichever term you prefer, come together and join anteriorly in the front. So pubic symphysis is here. Now, most of the time, you're going to be given hip bones that are unarticulated. So the first thing is to kind of figure out, well, what's front, what's back, how do these fit together so that you can identify the different structures. So I want you to think of this as a very demented Mickey mask. So here's your Mickey mask. These are the eyes of Mickey. These are the ears of Mickey. Okay. This would be, the nose would be around here. Okay. These would be the eyebrows. You kind of see what I'm saying about my demented Mickey mask? The ears of Mickey is this whole area here. This whole area here is called the ilium. I-L-I-U-M, the ilium. Okay. So the ears are the ilium. So this is the ilium. The ilium. The pubis is going to be the eyebrow of Mickey. And right here, because that's the pubic symphysis, or where it would be. Okay. So the eyebrow, the pubis, and pubis. Okay, so that's the pubis. Now, Mickey's been bad. Mickey's friend had a birthday party last night. Came to class, his eyes were bloodshot and red. He had bags under his eyes. Okay. So his eyes were really red. He had bags under his eyes. And he wants to ischium. This is the ischium. Okay. He wants to ischium. All right. So I've got the pubis here and here. The ischium, which are the bags under the eyes. And the ilium, which is Mickey's ear. A couple other structures you need to know. If you're feeling sassy, if you put your hands on your hips, what you're actually putting your hands on is this portion here. Okay. This is called the iliac crest because it's part of the ilium. So this is the ilium, and this ridge is the iliac crest. The iliac crest. That's where you would rest your hands on your hips. Okay. Iliac crest. And this hole here, okay, I like to think of dialing 0 for the operator. So this is the obturator foramen. So I think of operator, it sounds like obturator, the obturator foramen. It's a large opening because we have all sorts of blood vessels and nerves that need to project down to the lower limbs, and they do so through this opening. The last structure that you need to know for the hip bones is part of the hip joint itself, which is this large socket. This is the acetabulum. The acetabulum. Acetabulum. This is the acetabulum. This is the femur. This is the head of the femur. The head of the femur. Now the head of the femur articulates with the acetabulum. Now you see how much more stable this is versus the shoulder joint? It's a lot more stability here. However, our hip joints are less flexible. They have less of a range of motion than our shoulders do. But that's the trade-off. This is the anterior view, front view of this bone. So this is the posterior view. So this would be the back of the knee here. The back of the knee. Okay. So let's flip this to the front, and I'm going to zoom in a little bit. So we're going to look first at the proximal end. So this is the anterior view again. So the structures you need to know for this region is the head of the femur. This narrow region is the neck of the femur. Neck of the femur. And this large bump here is the greater trochanter. So this large structure is the greater trochanter. Greater trochanter. Now I also have this smaller bump here. This is the lesser trochanter. The lesser trochanter. Now if I flip this over, this is the head of the femur, the neck of the femur. The top portion is the greater trochanter, and the bottom portion is the lesser trochanter. The lesser trochanter. We get a little, so I'm going to flip back over to the anterior portion, and let's go distal now. This groove here is actually nice and smooth, and the reason is this is where the patella is going to rub across. We have a medial condyle and a lateral condyle. So your only question is, how do you know which is lateral and which is medial? So this, the head, is going to be on the medial side. Okay, so the head's on the medial side. So this would be the medial condyle and the lateral condyle. Now the medial and lateral condyles of the femur are going to articulate with the medial and lateral condyles of the tibia. And those articulate like so. And we're missing one thing here. The bone of the kneecap is right here. This is the patella. The patella. And that's where it would sit. It's considered a sesamoid bone because it's embedded inside of a tendon. And as you bend your knee, it's going to rub against this groove here to give some protection to the joint. Okay. So that is the patella. I can't ask you about it for an exam. There's no structures you need to know, but you need to recognize this as the patella. Here is the medial, and remember I knew it was medial because there's the head. Okay, the head sits medially. Okay, so that's the medial condyle and the lateral condyle. So that's going to be the medial condyle now of the tibia. So medial condyle of the tibia, lateral condyle of the tibia. Well, that's all well and good, but on a practical exam, how do you know what's lateral and what's medial? Well, the other structure that you need to know for the tibia is down here, and that's this structure, which is called the medial malleolus. Malleolus means hammer. Okay, so medial malleolus. So that means this is medial. So that's going to make this the medial condyle. We can kind of see it a little bit better if I do it like this. So the medial condyle and lateral condyle. Now the fibula doesn't do a whole lot of weight bearing. This is the fibula now. So the fibula, it tells fibs, so it lies, right? So the fibula lies laterally, lies on the outside, and it articulates like that. So it doesn't do a whole lot. Okay, the weight-bearing portion is actually this. If you look at how this articulates down here, this is that medial malleolus. This is what you feel on the inside of your ankle. Now, the bump that you feel on the lateral side or outside of the ankle is actually the fibula. Okay, so this is the fibula. So there's no structures for the fibula that you need to know. You just have to recognize it as the fibula. Here is the foot. The largest bone that we have here in the foot is this one here. This is the calcaneus. The calcaneus. It's the bone of the heel. You might remember calcaneal is the heel. So the calcaneus is the heel bone. Now, the ankle bone, so this would be a lateral view. Your ankle bone, now what you thought was your ankle bone was actually the fibula and the medial malleolus of the tibia. Your true ankle bone is the talus, which is this one. So you need to know the talus and the calcaneus. Everything else we're going generic. Okay, so this is now a top view, superior view. This is the talus, T-A-L-U-S. These bones here are all tarsals, T-A-R-S-A-L-S, tarsals. The arch of the foot is going to have the metatarsals. They're really nice and they meet up with the tarsals. So tarsals, metatarsals. And then the bones of the toes are all considered phalanges. I have 3 phalanges for each of the toes. So this is actually a pinky toe. 1, 2, 3. So that's a really tiny little phalanges, but they're still there. The big toe only has 2 phalanges, 1 and 2. Before I forget, because I almost did, this might show up. This is the hyoid. Okay, this is a bone of the neck. It's the only bone of the body that does not articulate with any other bone. So that is the hyoid bone. Okay. It allows for speech and swallowing.